7:39 coming up towards 7:40 in Trinidad and Tobago as we have a look at the situation in Debe, where at this hour you can obviously see that they're doing a better business as far as doubles and Sahina and Polori and so on at this hour of the morning via the camera of traffictt.com. More people parked in that area to get their breakfast at this hour of the morning. But we're leaving breakfast aside for a little while because we still have some work to do on Morning Edition, because we want to focus on the annual conference of the TTMA. Their theme, Leave No Child Behind, for the edition this year around. Again, it is the event put on by the Trinidad and Tobago Medical Association. It's coming up on Sunday. It's going to be at the Trinidad Hilton. It goes from 8 a.m. until 4 p.m. and will focus on current research in pediatrics and the social determinants of health. And to tell us more about the event, how you can register for it, how you can be part of the dialogue, we're joined by two personalities. We have Dr. Virendra Singh, who is the president of the Paediatric Society of Trinidad and Tobago, and also Dr. Colin Mootoo, who is the PRO, the Public Relations Officer of the TTMA. Very good morning to you both. Good to have you on the program with us this morning. And I have to thank Dr. Singh as well for finally identifying the name, the local name of the plant that we have with us this morning, because it's Tulsi, you say it's called, has a kind of medicine-y kind of smell. People use it to brush their teeth and so on?
They drink it in tea.
They drink it in tea, okay. All right, well, so you could boil it and make tea and so on with it?
Yes.
All right, it's not a bad idea. Thanks for telling us. I just see a bush by the side of the road. I decided to pick it. But anyway, let's move on to the event that we have coming up. So, Dr. Mootoo, let's give the basic information immediately. 8 a.m. to 4 p.m. registration from 7:30. It's all going to be at the Hilton Trinidad and Conference Center. What do people have to do to register for the event?
Right, so the event is $400. If it's a group of 10, it's $350. That's for healthcare professionals. So you could register online. It's www.tntmedical.com, or you could pay at our head office in Orchard Gardens. So like you said, it's an all-day conference. It's split into two halves. So the first half of the day are going to be lectures, talks that they have based on current research and current guidelines in locally and regionally. The afternoon session is going to be in a workshop format. So it's going to be 4 topics that we're going to be talking about in the afternoon. Moving away from the didactic lecture to more a small group session where there will be facilitators and a group of about 15 or so physicians where we would interact and speak about various topics.
Because of its nature, is this exclusively for medical professionals?
Well, it's targeted to healthcare professionals, yes. But not just doctors, but nurses. Like I said, this is a pediatric slant to our conference. So any pediatric nurses, physiotherapists, anybody who's involved in healthcare, they are welcome to attend.
So you don't have to be a member of the TTMA to attend?
No, anyone could attend.
All right,
Yeah.
so let's hear from Dr. Singh as to your own perspective on what is actually going to be happening at this conference and the importance of such a conference.
Okay, so the conference is dealing with several matters that, historically some children were left behind. Some children were actually not offered the level of health care that should be available. And still we have some restriction in what we could deliver locally.
What do we mean by that? Because many people will interpret leave no children behind. Is it because of income circumstances? Is it because of social factors? Is it because of particular ailments that just weren't picked up, certain developmental things that we ignored because of certain stigma, that sort of thing? What are we talking about here?
So more or less the last category that you spoke about, so things that were not either not taken head on because of a lack of capacity to do it or lack of willingness to do it, or just discomfort on people's part doing it. I mean, one of the topics is about Zika babies. Okay, and that's something that's very topical.
Very topical right now.
Yeah. And these children who are born will be growing up. So we're just going to have somebody speaking about what is in place for them. Where are they now? What is in place for them?
And what are you hoping from a conference like this? What are you hoping that will come out of it from the discussions, the group sessions, the information that is going to be passed on? What would you like to see actually coming out from a discussion like this?
The audience that we have targeted would take away something and have some sort of renewed vigor in attending to these children and improving their health care. And if that's some of what they attended, not everybody going to be able to attend the conference. It's your Sunday still, okay, but we want people to attend. But if even people who attend get some of that rub off onto some other people, some of their colleagues like within our office, and even disseminate some of the information within their office and in their attitude and approach to these children, well, hopefully we could get some sort of snowballing effect.
And Dr. Mootoo, just give me an idea as to why you all came up with this particular topic this year. Because I mean, when you're talking about the medical profession, there are many different areas which would be competing for priority attention. How did you all come up with this one?
So historically, if you look at our medical research conferences, we always try to theme it. So 2 years ago, we focused on the non-communicable diseases, diabetes, high blood pressure, etc. Last year was more mental health. That was the approach last year. And this year, we decided to focus on the little people because, like you said, leave no child behind, as Dr. Singh was speaking about. We felt that there were certain gaps that were not being met. Differently abled children, for example, it's not just simply about healthcare. Yes, you could come to clinic, we're seeing you every 6 months, but what about the social aspects as well? It's not just healthcare, it's also social care. And these are issues that are going to be spoken about. It's an important conversation that we need to have. And we look forward, like I said, to having everyone come and taking part in these conversations. It's not just, well, he mentioned Zika babies. It's some groundbreaking talks about cannabis. There is one of our local doctors who has gone to Canada, and she has done some research in cannabis, and she's coming back to relate to us the use of cannabis oil in refractory epilepsy cases. So I think all of these are important conversations that we need to start. We have seen decriminalization of marijuana now.
Not yet in Trinidad.
Not yet in Trinidad. It's still illegal here, but it is a talk that even the Prime Minister has said we need to start open the door about this.
Does the TTMA have a position on that? The reason I asked is because I noticed, you wouldn't have been aware of this, but yesterday, Ms. Nazma Mullah, who was one of the advocates of it, and finally, after advocacy, persuaded the Prime Minister to put this on the agenda after he appeared to push it off. She is saying that nothing has been done since then from a legislative point of view. But does the TTMA have a position on this?
Well, we abide by the law, and it still is illegal in our jurisdiction. So no, we can't. It's still illegal, but it's still something that requires further research in our own local setting.
Because I know one of your professional, Dr. Azad Isaac, he did a piece as well on that. I think it appeared in the media also, where he raised some concerns as to whether or not people are rushing towards something and not really assessing all the data properly as well.
Exactly. So if you look at other areas where it has been legislated, for example, the United Kingdom, November 2018, they have decided that cannabis oil can be prescribed by a specialist, not by a GP.